Steve Karim. I'm the Deputy Director, Epidemiology and Disease Control with the Ministry of Health and Childcare. I'm involved in pandemic preparedness and pandemic response. As we are aware, global health has become the major thing in terms of health security in the whole world. So 2025 has been a very significant year in terms of global health. We have seen a lot of developments on the global stage and the international level. Globally, we saw the signing of the Global Health Treaty, called the Pandemic Treaty, where more than 190 countries appended their signature to ensure that there is global health security. And Zimbabwe participated in the whole process, from the development of the treaty up to the signing and the ratification by the Global Health Assembly. So this is a commitment by the country to ensure that we contribute to the safety of the world in terms of global health, in terms of public health issues. As we are aware, because of trade, because of movement, diseases know no boundary. Diseases can travel from one part of the continent, one part of the world, to Zimbabwe within minutes because of the interconnectivity that we witness. So it's prudent and important to ensure that our points of entry have got capacity to screen and do what is necessary to ensure that you protect the health of the nation and also protect the health of travelers. So we are building capacity around our ports of entries, both air and ground crossings, through training of surveillance officers who are capable of screening, isolating, referring and offering the necessary treatment right at the points of entry, and referring to appropriate institutions that have capacity, equipment, human resources to then handle if there is need for that referral. So this is something that is happening and something that is very important. Recently we saw Mpox being declared public health disease of public health importance by both the World Health Organization and Africa CDC. That then jostled us to then act and ensure that we had the necessary tools to do necessary and appropriate screenings at the points of entry. Ebola also has been declared in the Great Lakes region, particularly in DRC, and we have heightened and strengthened our surveillance, particularly at ports of entry, but also at health facility level. So this frontline training adds and builds capacity to ensure that screening is done appropriately and diligently at ports of entry. Thank you.
Hello, my name is Beryl Notani Makosa. I'm a port health officer at Robert Gabriel International Airport. I just graduated in the Zim FETP Frontline Program for points of entry, and I presented on surveillance analysis of human remains repatriated through Robert Gabriel International Airport. The program is going to help me in my area of expertise in ensuring that we detect and control outbreaks early. And we can also, at the airports, we also have scenarios of emergency landings that happen precariously or at any point that we have no idea where they're coming from. We only know signs and symptoms, and we do not have any diagnosis. So this program has enabled, or it has empowered me to be able to assess and make an informed decision on those situations or those peculiar scenarios that we usually experience. We also will be able to analyze and assist our head office in coming up with tangible recommendations for action. That's all I have to say. Thank you so much.
I'm Jennifer Namo. I'm a nutritionist at the seat of Harare City Health Department. I'm also part of the work staff that is manning the Public Health Emergency Operating Center at Wilkins. I'm so glad and excited that I've completed this 3 months field epidemiology training program, which was actually equipping us, to do the public health surveillance system, to improve our public health surveillance system as cities. And City of Harare, we've been part of this, and it was an exciting journey. Now, when we go back to our communities, I'm sure we are now equipped to respond well in terms of disease outbreaks, detect outbreaks well in time, so that we can control and safeguard the health of the community in Harare. Thank you.
PHO Port Health Officer, Kazungula Border Post, Victoria Falls. I currently graduated for the Field Epidemiology Training Program. With this program, it has equipped our skills in epidemiology. As port health officers, our main goal at ports of entry is to safeguard public health and prevent the importation of disease to our country. With this program, now we're able to detect, investigate, and respond to any public health threat. I can tell you now we are prepared for any response to any public health threats. Thank you.